Medical errors are one of the leading causes of death in the U.S., taking the lives of more than 250,000 Americans each year. Misdiagnoses, medical errors, and botched surgeries harm too many patients across our country. State medical boards are supposed to protect the public by checking out doctors' backgrounds and investigating complaints of medical harm. A new report from the Informed Patient Institute and the Patient Safety Action Network show medical and osteopathic boards across the country don't provide the public with enough information to evaluate their doctors.
The public should know if their doctor has a disciplinary record, because that would be actually a pretty important thing to know before you walk in their door and receive care from them in a very kind of personal way.
Kara Cronin, a co-author on this report, founded the Informed Patient Institute in 2007.
The criteria that we used in this report, we used 23 criteria, and those criteria were in 4 different categories. The first category, we looked at what we call general information, and that included things like, what is the mission of the medical board? What do their homepages look like? How accessible are they? How easy are they for the consumers that use them to find information? Probably the most important category was criteria that looked at what is actually on the physician profile. And the physician profile is a web page on a state medical board that is for every individual doctor, that contains all of the information about that doctor. It also has the important information about whether the state medical board has ever taken action against them. It's pretty important from a patient safety standpoint to know if your doctor has multiple sanctions, has multiple malpractice suits.
It isn't difficult at all for medical boards to share information with the public on disciplinary information about doctors.
Lisa McGifford, co-author on this report and board chair of the Patient Safety Action Network, has worked throughout her career for transparency and patient safety throughout this country.
What we found in our report was that a few states make it real easy to find the information, but most states make it too difficult to navigate. Most of them have this information in their files. All they have to do is create an easy navigation from their website to physician profiles. It's important for medical boards to summarize in plain English what the doctor did to get disciplined and what the discipline was. We want a summary, a plain English summary that anyone could pick up and read and understand. I think a lot of medical boards don't disclose this information because nobody pressures them to do it, and there probably are pressures in most states from the medical associations to not make this information too easy to find.
A former North Texas neurosurgeon was sentenced to life in prison for a botched surgery that severely injured one of his patients.
But he's accused of killing or injuring other patients through similar reckless medical procedures.
Previously revealed, the state agency was keeping some doctor disciplinary records secret, contrary to state law.
Standard of care, it's a broad term. It's the expected level and type of care provided by the average competent health professional in a given situation. You have to be pretty bad, in my view, to be outside the standard of care. Those are the folks that the physician community and the public should really be worried about. I think it's very dangerous to patients and families when physicians are given lots of chances and are still harming patients.
We think one of the most important pieces of information that medical boards could provide is the number of complaints received about a doctor. Medical boards typically take action on a very small percentage, under 10% of the complaints that come into their door. We want to know, how many complaints did a particular doctor get about incompetence or about sexual misconduct? That's the kind of information we think should be on the profile, and there's not a single medical board in the country that provides that information. The mission of every medical board in this country includes the phrase, protect the public. Legislatures should keep that in mind whenever they're looking at laws or proposed legislation to change how transparent a medical board might be. The first step in protecting the public is to warn them, let them know what doctors have been disciplined and what doctors have done. That's the first step of transparency, and the legislature can play a very important role by changing the laws and creating mandates for medical boards to report this kind of information.
You know, the vast majority of physicians are hardworking, really patient-centered. It surprises me that they allow the bad apples to continue. That surprises me as a profession, because it ultimately undermines the whole profession. It undermines trust in the profession.
Our biggest hope from this research is legislators will look at it and will offer more information to the public, that medical boards will improve the kind of information they have on their websites and make that information easy for people to find. And when they take action against a doctor, they should do everything they can to make sure the public knows that this doctor has been disciplined.
To look into your state's medical board, please read the report at informedpatientinstitute.org and patientsafetyaction.org.